Welcome students to Rad 111 Procedures 1. I wanted to introduce you to some of the supplies that you will be using in the lab and in the clinical setting to help you get those images. The first that you see here is going to be the different type of plates that we use to capture our image. The black one is known as a DR plate, and that is digital radiography. This one allows us to directly access the image via the computer without having to take the plate out of the room. Now this plate costs in excess of $150,000. Yes, just for one of those black plates there. Now the black side is going to be the up side, so that's going to be the side that's closest to your patient. And the gray side is going to be the one that holds the battery. And this one is going to be furthest away from the patient. Here you have cassette radiography, which is normally just in the doctor's offices, but I did want to show you because you may use these. But with a CR cassette, the green side is the side that's going to be closest to your patient, and the gray side, which I have here, is going to be furthest away. There's the black with the green trim, so that's going to be closest to your patient. But inside there is like a whiteboard plate that captures the information as the X-ray photons go through your patient. And then this has to go to a processor, which takes the plate out of this holder and reads the information and then transfers it to the computer. Next, we have some supplies that you will be personally wearing and using. So here you have your left and your right marker. My right is my red and my left is my blue, and it'll also have your initials. You'll be using this to mark the anatomical side of your patient so they know if you're x-raying the left or the right side of the patient's body. Here is a dosimeter, and this is used to help see how much radiation you're being exposed to. Now typically you will have very low doses of radiation because we do not stay in the room as the patient's being x-rays. However, we do get monitored on a regular basis to ensure that we aren't getting too much for any specific reason. This is worn up on your collar at all times whenever you're in the lab or at your clinical setting. So both of these you are required to have every day when you come to lab and when you go to clinic. Next, we have various size sponges. Now these are immobilization devices, and they help us to help keep the patient in the position that is required for the projection or the image that we're trying to take. So this is a 45-degree sponge. The patient can lay on their side to help them rotate their body and maintain a 45-degree angle. This is a square sponge, and here is another angled sponge. So you will find these various shapes and sizes in the lab as well as in your clinical site to help hold your patient still. Now these are also known as radiolucent supplies. So what radiolucent means is that the X-ray photons can pass through this and it will not block the anatomy that you are trying to X-ray. The next thing that we have, which is very important, is going to be your shields. Now we use shields to ensure that parts of the body that do not need to be irradiated are protected from the radiation that is going through. So you never want to put a shield over the anatomy that you're trying to visualize, because these are also known as radiopaque, which means that X-ray photons cannot pass through these because there is lead here, and lead absorbs X-ray photons. So this is a thyroid shield. It goes around your neck, and this is known as a lap or waist shield. It can be placed on your lap or over any body part that you want to protect. And then we also have a rolly shield. So if the patient is standing erect, you can place that either in front or behind them, and it is adjustable. So you can just use that knob right there and adjust the height accordingly. Next, we have calipers. Calipers are used to help measure body part thicknesses or to use as a straight edge when you're trying to ensure that the patient is in a true lateral position. So those are your calipers. Next, we have the technique chart. Now the technique chart is what you use to actually put into the control panel when you want to make an exposure. So once you have determined what type of x-ray you're going to be taking, say for instance we're doing a chest x-ray in a stretcher, it gives you the technical factors that you have to put into the control panel or into the computer in order to generate a visible image. And you'll talk about that in extent. Each control room has to have its own control chart or technique chart. You cannot necessarily take one technique chart to another room because each room is calibrated differently and each room may have varying types of equipment. Up here is a rad bag. So this is just a plastic protective cover that you would put one of those cassette plates or imaging plates into if the patient was bleeding or if there was a lot of dirt or something from the injury. It would protect those expensive plates from being contaminated with bodily fluids. Here we also have some wipes that you would use to not only clean your plates but also to clean the x-ray equipment that you were using to ensure that it is going to be safe and clean in between your patients. Here we have BB markers. They're also known as nipple markers. It's just a lead BB, and some doctors like to have this placed on the area of pain so when you're taking an x-ray they can visualize exactly where the pain is because the BB will show up. Once again, these will also be radiopaque. So this is just an overview of some of the general routine equipment that you will be using while you're taking your x-rays. Good luck and congratulations.